Thank you very much.
Thank you. Right, we'll make a start and go on to our colleague, Dr. Paul Quarren. So, Paul, can you just give us an example of your successful private sector engagement in Uganda? Over to you.
All right. It's good afternoon from Uganda. Thank you very much all for having me here to discuss private sector engagement. I'll just probably give a few highlights of where we believe we have recorded some successes in engaging with the private sector. I think one of the most notable ones is being in our distribution model. We are national medical stores. We are a government entity mandated to distribute essential medicines to all health facilities, government-owned, across the country. This number's about 3,000 across more than 100 districts. And a couple of years ago, we were basically distributing our supplies down to these individual districts across the country, and we expected the local governments in those areas there to take custody of these commodities and transport them down to the individual health facilities and make them available. Because in the setup in Uganda, service delivery is meant to be the mandate of the local governments. We have such a model in government. But we found a lot of issues with capacity downstream and funding and uncoordinated activities within the district. The levels of service across the country were not the same, and we were not able to get any level of performance down at the district level as we had expected to see from ourselves. So one area where we did look to innovate by engaging the private sector was to involve them in our last mile distribution, and I think it's become a very popular model across the continent, especially for the essential medicines. We basically worked with private sector organizations to develop a model where they would support the district infrastructure to move essential medicines basically from the medicine stores at the districts down to the individual health facilities. It allowed us get into contracts with a couple of firms. At most, we have engaged 3, but never more. We often have 2. Right now, we're operating with 2. And what we're seeing is a seamlessness, or at least a similarity in the quality of service across the country. We have fewer points of control across the supply chain in the country, and we now have expectations that are being met more often than not when it comes to how much time it's taking for medicines to arrive at health facilities, the quality of service, and also general understanding of the SOPs that we provided for how the essential meds should be handled and transported down to the individual health facilities. It's been very, very helpful for us. We have been able to increase the availability of medicines across the health facilities substantially. The latest reports we're receiving from the Ministry of Health indicate that for the basket of 41 tracer items, we have stock availability of above 80%, which is quite incredible given the level of funding we have for medicines in this country, and also the very weak structures and systems that we have around the supply chain. So for us to be able to achieve it in an environment like this, I think is something that is worthy of sharing. I'm very grateful that the good Dr. Fundafunda also invited me to come and speak about it. There are other areas I know where we have worked with the private sector to enhance our efficiencies, but I think for now, just for an introduction, I think that is one area where I definitely would like to make mention that we have made strides in working with the private sector to enhance the mechanisms we have for making medicines available throughout the supply chain. Thank you.
Thank you, Paul. A follow-up question from me is to ask you why you think this private sector engagement has worked, or have you successfully replicated it since then or else?
Reasons why I think it has worked. It would just not have been feasible for us to have that number of people on the ground and be able to properly supervise them. We are working out of a central medical store. We've chosen a model where we do not have regional warehouses. So we try and work out of a central warehouse to keep our operational costs as low as possible. But when we were trying this model of last mile delivery, it was very clear that we had an idea and principles around which we thought we would enhance the availability of the medicines through an optimized supply chain down from the health facilities. But exactly how the mechanics would work from the district down to the individual health facilities were not absolutely clear. So rather than go to recruit people who you may later have to lay off if you find them not to be necessary, it's easier to engage with a third-party provider who at least can test the waters for you. He can recruit 100, scale it back down to 20, scale it back to 200 without huge issues. But us being a government-owned corporation, that level of flexibility is not available. So for areas where we need to innovate, to pilot, and to explore new areas where we can try out different things, that is where we believe private sector is best. Later, when the systems are more established and we believe that maybe the government can even make the extra investment in that area, that can come a little bit later and that discussion can be had. But for the virgin areas where we believe we are looking to innovate and to go beyond the limitations that we have had right now, or even what traditionally government has done, I believe it's much easier, much safer, much cheaper, and also you can do it within a shorter time frame when you engage a private partner to do a job for you and then take lessons from what they have learned and then build on those so that you can end up with a robust system. The way we started out with them with last mile has evolved over the years. Many of the assumptions we had have changed drastically because of the experiences they have brought back to us and actually advised us how best they can do it, and also let us know the capabilities they have on their side that we could take advantage of. So I think this collaborative experience over the years, I think, has helped us shape what our last mile delivery system has come to be today. And that is exactly where we feel that the private sector is very good at being at the sharp end of innovation and allowing them to make the mistakes and not us, I think is what I'm saying.
Indeed, that's very interesting, Paul. I mean, in your presentation, there's very clear role of private sector that you've illustrated, and depending very much on their capacity, strength, and expertise. So I'll move on to Dan to see how UPS has taken up this role of the private sector lead in testing the waters and providing the innovative service. So Dan, how has UPS experienced this role in Uganda? Over.
Yeah, well, thanks, Bonnie. It's really part of the UPS Foundation's mission is to engage in private-public partnerships. So this was really a perfect fit for UPS. And to that end, several years ago, UPS was looking at Uganda and looking at the distribution model from the district locations and warehouses to health facilities. And something we saw in challenges were, lack of visibility to demand. We saw, challenges with control and inventory. Temperature control certainly was an issue. Established standardized KPIs. And we saw challenges with allocations and record keeping. And so really our approach was to help develop an inclusive solution adopted by all the stakeholders so involved in the program, which I think is really kind of key to any solution that we've worked with. So this one in particular was led by Gavi. We had a local partner, Freight and Time, that was our delivery agent. NMS certainly was involved, and they provided innovative leadership and provided stock management roles and responsibilities. We had CHI involved for data collection and analysis. We had the local health facilities were responsible for preventative maintenance. They were responsible for temperature monitoring, records management, those kinds of things. And then really UPS was responsible from a private sector's perspective on the supply chain, consulting, technical assistance, and training. So as an example, we use state-of-the-art but time-tested, proven supply chain visibility tools that understand demand, at the point of consumption, which is really at the health facilities. And some of the tools we leveraged were we were able to manage waste data. We provided proof of deliveries and records reporting. We created equipment and exception reports, and then we built GPS optimized delivery routing. So those were really key fundamentals to what we saw as successful. And we've been operating for about 30 months in 3 districts in Uganda. We service a population of about 3.2 million people. 650,000 of those are children under 5. They have about 50,000 live births annually in those particular districts. And really, I think ultimately was, collective goal was to improve vaccine availabilities at the health facilities. And we've seen some great results, both from our midline report and our most recent final report in the past 30 months, just looking at some of the key health statistics. The percentage of health facilities with all 9 vaccines available went from 54% to 85%. The percentage of health facilities reporting stockouts declined from 24% to 5%. And before the program, none of the health facilities did a consistent physical inventory. Now we have running 79% of locations do a physical inventory. We've seen improvements in expired product from 10% of facilities down to 2%. And then really, I think one of the most telling was the distribution of delivery vaccines. About 4% of them were done with a dedicated or a defined network. And now in those districts, 97% are done. And that does a lot of things. It improves chain of custody. It improves validation of temperature control. It verifies inventory optimization. So those are all, really key things we think in the success of the program. And I think it really goes back to, a couple of basic items. It goes back to it was a collaborative solution. It was inclusive of all partners that were involved, and it was adopted by all the stakeholders that really were part of the program. So, by and large, we think it's been a great success, and we're certainly excited about the next phase, which we'll look for in 2021. And I'll turn it back over to you, Bonnie.
Thanks, Dan. I'll actually take over here. I just wanted to remind all participants that there is a discuss option to ask us questions. So please feel free to send through those questions and our panelists will answer them at the end. So what we often hear at ARC is that private sector engagement in health systems is that someone comes to us with a service that isn't proven, and we don't know how that will work. So we've got Israel from Zipline on the line or on the panel, and we'd love to hear more about your drone project in Rwanda, and to understand the approach that Zipline took to overcome this challenge of how to prove an innovative solution. Over to you, Israel.
Thank you so much. I think, when Zipline and the Rwandan government started talking about 4 or 5 years ago, it was really important to bring around the table several partners, and we are really grateful to be able to work with the UPS Foundation and Gavi and others to really convince the government of Rwanda of why it's probably important to take a bet on an unproven technology. I think the need was there, the pain points were known. And so the government also was flexible enough to explore where best can we start. And that's why, from a proof of concept perspective, the government really felt like the blood use case was probably the best thing to try this technology on. It had fewer SQs, fewer health facilities serviceable, and so it was going to be really fast to confirm whether it works or not, which we fortunately have been able to do in the last 2-3 years. And then we expanded to Ghana on a much larger scale, on a national scale, to be able to take on a wide variety of use cases. And really, what we've seen in policymakers and supply chain leaders in places like Rwanda and Ghana is that capacity to really understand that, what we've done over the last 10, 15, 20 years can be able to be rethought, and we can be able to challenge our own assumptions around what it takes to be successful, and around how we can solve certain long-standing problems. And so, all we had to do on us as a private sector player is to really meet them in the middle and try, instead of building a fancy technology that just flies in a way or another, adds maybe pain points to the end user wherever it's flying. We really had to design our technology in mind of how the people would want to use it. For example, our drones don't land at the health facility because we don't want the person at the health facility to figure out how to make it fly back. It just drops a package and then flies back. We also started building warehouses near to our drone pods. So what we call our distribution centers are part warehouses, part drone pods. And the system is very integrated in a way that since we started on the blood use case, we could be able to respond very fast, but that can also be adapted at scale on any type of product programs or use cases that we are operating in. And so what we've seen is generally a very engaged partners and very open-minded type of stakeholders around what it is that this technology can be used for. And today, especially given the pandemic circumstances, we've seen people coming to Zipline and say, can you try this? Can you try that? And that's how, for example, in Ghana, because we don't do reverse logistics, but our hub is fairly far away from the city. It has been used as a collection point for samples collected in rural areas. And then we are able to fly them into downtown Accra at the lab, which from a technical point, it's the first time that drones were flying in a highly dense area of a capital like Accra, but also really a creativity from the public servants on what it is that we can do with our existing partner today, and not really being boxed in what were the use cases that were initially worked up when we started working together. I hope that answers your question.
Thank you very much, Israel. Dan, you were also involved with this project in Rwanda through your UPS. So it would be very interesting to hear from you how you approached this unproven Zipline technology.
Yeah, well, thanks, Bronwyn. Really, just like our last example, engagements with our foundation really, meets that robust challenge of the public-private partnership. And, I think it goes without saying, I think all industries right now are just going through, massive disruption due to technology. And so through at UPS, we have an advanced technology group, and they research, test, and develop new technologies. So whether it be automated vehicles, drones, package sortations, route optimization tools, those are really all examples of the types of engagements that our advanced technology group looks to improve not only in the humanitarian space, but also on our commercial network and, improving visibility and efficiency within our network. Being part of the drone project in Rwanda really helped us look at a new technology, enables us to have a front row seat in the trials and tribulations of how that technology works. It also really helps us better understand cost models associated with new technology on both the supply and on the consumption side. So it's when we, as Israel had mentioned, when we first saw some of the initial challenges, we saw hurdles, with the new drone solution in product security, integrity, connections at the delivery point, as Israel noted, the drop, so there's that chain of custody and proof of delivery and all those types of challenges that you typically, might not always have. But I think some of the outcomes that we've realized and validated, I think as Israel also know, we saw, positive patient impacts. We saw the ability to scale operations both in country and in additional countries as it's grown. With the Ministry of Health, has been able to expand and increase the types of products available within that network. And really our role, in that initial rollout in Rwanda was logistical support for the setting up of the network. We provided funding, we provided time expertise, and we provided materials. And again, I think some of the common threads that I mentioned before, and Bronwyn and Bonnie both noted, was there was common purpose, there was goal alignment on what we set up, and there was agreement among stakeholders on exactly what we were trying to accomplish and what the scope of the project was. I'll turn it back to you, Bronwyn.
Thanks so much, Dan. So I think we'll change tack to our donor partners. Matthew, in your role as the Senior Advisor for Strategy at PEPFAR, what successful private sector engagements have you seen in outsourcing supply chains and public health?
Thanks, Bronwyn. It's good to be with you all. So at the core of PEPFAR's next generation supply chain strategy that we formalized at the end of last year into this year is to make the supply chains more client-centered, get the medicine to the patient, not the other way around. And also encourage our government partners, work with our government partners, MOHs in particular, to sort of step away from operating supply chains and into the business of managing and overseeing them, which is at the core of the discussion we're having today. The private sector is a critical partner in this, and on this front, we've made important, somewhat isolated strides in this direction already. And one country that's sort of exemplified this progress is Mozambique. So I'll be describing work of USG colleagues in partnership with the Mozambican government. So it's not my work per se. So I'm happy to help with any follow-up to get technical or clarifying questions back to folks, or answers to those questions back to folks. But so in 2013, the Mozambique ministry developed a pharma and logistics strategy that envisioned outsourcing. But in part because the Mozambican system, they don't have a single central command structure around supply chain. You have national, provincial, and district actors and decision makers that don't historically or haven't historically coordinated particularly well. So the implementation of that outsourcing took some time to develop and materialize. The Mozambican supply chain system had also been somewhat beset by infrastructure challenges, like chiefly aging and broken down trucks in need of costly repairs. So they had to rely on the clinical implementing partners to come and pick up the materials and bring them to the commodities and bring them to the facilities. That didn't work particularly well because you had to sort of take time to set up motor pools. The routes were not optimal. It wasn't done as professional a way as you'd hope. So working with USAID partner Village Reach, which has a long history in Mozambique, they started a pilot in Zambezia province wherein route optimization was performed and Bolloré was contracted or outsourced by Village Reach to provide management of last mile delivery. The result was a successful pilot, which I'll talk about, such that it expanded beyond Zambezia and is now is operating in 8 provinces with a plan to be in all 11 Mozambican provinces by the end of 2021. This work was critically complemented by a related line of work with CMOM, the Mozambican government's supply chain arm, to streamline a unwieldy system of 133 provincial and district warehouses into a smaller number of about 33 strategically located intermediary warehouses. And in terms of performance, what we've seen there is 15 straight months of 99% delivery in full, with 74% of that on time as of Q3 2020. So to carry this work forward and for it to be fully realized, mid next month, there'll be an award under the CHEGAR, which is in Portuguese for to arrive, whereby USAID will directly hire a 4PL who will hire, coordinate, and oversee all 3PLs operating in the country. Village Reach will continue to support by providing the 3PL providers support on improving their processes, efficiencies, data platforms, visibility, etc. And they'll also work with CMOM, who's been an incredible partner in this sort of evolution to more contract management and overseeing the implementation of supply chain and the operation of supply chain rather than doing it themselves. Because the goal is for CMOM to oversee these contracts in the longer term. CHEGAR will also include incentives as part of the contract on time in full, and the performance-based contracts would allow for about 8% upside, up to 8% upside for that contractor if they deliver on time in full at a high level. So an important incentive is now built in. So just very quickly, the lessons that we've taken away from the Mozambicans' experience. Start with a motivated province and demonstrate how it works. Within each province, in the case of Mozambique, they started in just 2 districts and then working out the kinks and then sort of in an phased implementation, fan out to other districts. From the get-go, develop transition plan early for the government to play an increasing role of responsibility, and that should include training around supporting versus the oversight of versus the operation of supply chains. The Mozambique experience shows that there's a place for a sort of utilizing a trusted intermediary. So Village Reach played an important role as a kind of trusted go-between government and the solution providers, since they speak kind of both of their languages, as it were. Allow for a learning curve. Solution providers themselves may have a learning curve, so strong and frequent lines of communication are critical. And then, of course, I would say related to that, don't assume that there's common understanding of the full scope of outsource implementation, the terms, the indicators used. So be clear on the specifics and get on the same page. So I'll end there.
Thanks, Dan. Bonnie, I see you're back here. Would you like to ask the next question of Lauren, or shall I? I think Bonnie's having internet troubles. Lauren, as our private sector engagement... don't worry, I'll take over, Bonnie. As the private sector engagement lead for PEPFAR, it requires you to make assessments for your potential private sector partners and who you'll work with. What are some of the practical things that you see when making those assessments that tell you a private sector engagement will be successful?
Thanks, Bronwyn, for that question. I want to start by acknowledging that from the PEPFAR perspective, we really do work with the private sector in many different ways. So you just heard from Matthew about PEPFAR's supply chain modernization strategy, where we really look to the private sector as a critical player in delivery and distribution. To Bronwyn's question, I want to switch tack a bit and talk more about how we really partner with the private sector. And the types of partnerships I want to discuss are often co-created. They bring in ideas and contributions of the private sector along with the capabilities, resources, and technical expertise of the public sector. In the supply chain world, this means, for example, a partner like PEPFAR might bring our expertise in HIV as well as a large-scale platform of clients and clinics to the table, while a private sector company would bring its know-how in efficiently delivering products to those clients and clinics. And we have some great examples of partnership in the global health or social good space, many of which you've just heard about. For me, one of the hallmarks of a good partnership is that we're really all sharing in both the risks and the rewards of the partnership, and that we're all putting something of value on the table. So private sector resources and infrastructure and skill sets really enable us as PEPFAR to develop programs that are more effective, efficient, and sustainable. So I want to talk, practically speaking, about a few of the enablers that I think are the most important in really building those public-private partnerships. The first is that the partners must agree on what success looks like and how that success will be measured through metrics or KPIs. So you heard from Paul in Uganda, for example, about how they were measuring stock availability or on-time delivery. You want to make sure that all of the partners have that same common language and definition of what those KPIs are going to be. The second element is that all the players are really transparent. As a private partnership builder, I put a lot of time and effort into those relationships with our private sector partners so that we can get to know each other and really have those honest and open conversations about what success looks like and what's important to our respective organizations. And then I really look for partnerships where private sector is bringing something truly unique to the table, something that we don't necessarily have as a big development partner. Generally, that is expertise or a skill set or a core competency, and it's often one that links back to the private sector partner's business. It could be, product design or some of the innovation that we heard about from Zipline and from UPS today. It could be market research. So we really do value those skill sets, that intellectual investment, just as much as we value financial resources. I'll give you a couple examples of how we've done that in the partnership world. We've worked with consumer goods companies, for example, like Johnson & Johnson or Nike, who lend their consumer marketing expertise, the same expertise they use to reach customers with products. And they use that to help us develop brand and marketing campaigns to reach population groups with health services. And then likewise in the supply chain space, we've worked with companies like Coca-Cola or SAB Miller, who will use their trucks and their delivery system and their database to deliver health commodities on their trucks to the communities that we're trying to serve. And those partnerships have been really effective because they benefit everybody. A lot of our partnerships are strongest when we really share the same overall vision or same objective of what we're trying to achieve. But we do work with the private sector in ways that give them an opportunity to realize their own business interest or their corporate social responsibility interests in a meaningful way. And then lastly, in the partnership world, we really do try and ensure that there's a strong governance structure in place so that everyone understands how decisions are being made and that we're all able to hold each other accountable and make sure everyone's aware of the role each partner is playing and what commitment they're making and help ensure that they will deliver on that. So we do often have memorandums of understanding with our partners to really outline those roles and responsibilities. So Bronwyn, going back to your original question, we really value the contributions of the private sector, both in the partnership space as well as in the procurement space. And many of these partners that we work with are represented on this panel today. So you're really getting the opportunity to hear firsthand what makes a good partner. Thanks.
Thank you so much, Lauren. In the interest of time, I think we'll go straight on to questions. And then if we've got some time afterwards, I'll ask for last thoughts from our panelists. Paul, there was a question that came through around looking towards 2025 in the future. What do you see as the next generation of supply chain as it relates to private sector engagement and outsourcing?
Um, 2025, I think if we were to look to the future that far, sometimes right now it's a little bit difficult to stick your neck out that far. But I think the ideal situation with the private sector would be a supply chain that would see us link the downstream agents that we have up to our suppliers. Essentially try and see how we can reduce the reliance of warehousing within the supply chain. And for items where we know where they're meant to go and there is more stable supply and demand, I think looping around the warehouses to have a leaner supply chain system would be something that we may be looking at. If we have manufacturers, for example, of ARVs in the country, and we know exactly where these ARVs are required on a monthly basis, on a weekly basis. The reliance of having them pulled to a central warehouse and then dispatched further is something perhaps we could be looking at. See if we could have same level of visibility and accountability and chain of custody throughout the supply chain, but engage our upstream supply chain partners who are generally the manufacturers and suppliers and link them to the ones who are doing the distribution on the downstream and allow us just to monitor and ensure that those metrics which we are striving to achieve can actually be reached. So basically we're trying to see if we could almost loop ourselves out of a job, but I think that is where we'd actually see our greatest gains and more efficiency within the supply chain. That's just one area.
Thanks so much, Paul. I have another question here from MJ. I think I'll address this to Israel. MJ says that we see supply chains are seeing disruption more and more often, and we'd like to hear from you around how you think the private sector can ensure that they're ready to cope with this and how they can help not-for-profit organizations and governments get ready.
I think there are multiple angles to look at it, depending on the nature of the supply chain, the private sector partner. I think Zipline is uniquely positioned, as Lauren was saying. I think there is the expertise side, but also of the understanding of what it is that we are bringing to the table. But there is also the innovation side, right? Zipline does it very differently than any other supply chain provider would be able to do it, or distribution provider would be able to do it. And I'll also tap into what Paul just said around, how do you get to think further into the future on building a lean supply chain and be able to deliver. And what Zipline Innovation does is, if you have 700 health facilities around a certain area and you're able to reach any of those, it really changes how you go about planning, route planning, processing, and how you address certain challenges around limitations on vehicles, around routes, around external factors like roads, infrastructure, and so on and so forth, right? And so my understanding is that for us, I think we bring together those two capacity, the fact that we are providing a very innovative solution and a very innovative ways to go about it, but also having had the fact that by building that innovation, we've developed really a strong capacity to understand what needs to be done. I think we can be a thought partner around how do you think of these type of disruptions that are happening and how do you get to address this. Today, it's just a matter of responding to disruptions, right? With COVID-19, we started rationing things that we'd never rationed before, such as PPEs, gloves, and masks. But really the future is more on how do you give everyone exactly what they need. And in other sectors that most of us are never into, in blood, for example, that's the normal way of going about things, right? For blood, every hospital has a maximum and minimum of amount of products they can request and have. They have very clear set of, how do you go about this and how do you get yourself another product when you need it, so that we ensure that everyone gets what they need when they need it and no one has a huge buffer stock or are overstocking, or the supplier is not forcing everyone to just have a huge stock because they just don't want to take that route 4 times a year and they'd rather do it only once a year. So we really kind of come into a way that on what Paul says, it's what the future is going to be like. How do we really support NGOs and governments to be more in a position to be able to respond with agility to any type of circumstances that's happening, by building agility into how they can be able to quickly respond to that. Unfortunately, Zipline is only able to do that on the last mile side, but I feel like the world is kind of waking up to the idea that this has to happen all the way from the manufacturing processes and availability to the port of entry. And then, partners like Zipline can take it from there and making sure that, as Matthew said, the medicine gets to the patient and not the patient to the medicine.
Thanks, Israel. I think we've got enough time for one more question. And Matthew, I think this might be a good one for you. Are we doing enough now to prepare our countries the 2025 and onwards future? And is there any more that we need to be prioritizing now to get that future ambition realized? Matthew, you're on mute. There we go.
Can you hear me now?
Perfectly, thanks.
Okay, sorry about that. Well, I was looking at just very quickly at Wendy's question with respect to how do you set up a private sector engagement, and just a couple lessons I think gleaned from the Mozambican experience and some others that we've seen in Nigeria and in Haiti is really start by starting. Start small and demonstrate small success. Nothing succeeds like success. And it's useful for demonstrable purposes to start to win important stakeholders over that initial implementation was successful. So there's no substitute for being modest in your early ambition and demonstrating success and sort of growing from that in terms of the scope of what a partnership would look like. I know ARC has been instrumental in developing a toolkit, which is going to be, I think, a useful guide in practically helping governments sort out how they go about that outsourcing process, of, evaluating the opportunity, understanding, does outsourcing make sense for them or not? Where are they on this kind of so-called maturity journey with respect to being amenable to private sector outsourcing? And then the processes you go through, the metrics that you would hold potential contractors or solution providers accountable to, the examples of contracts and KPIs, et cetera. All of those things will be very sort of practically useful for countries that are embarking on this journey or in the early stages of it. So to give that a little plug, we're going to be providing a link to that in our COP guidance so that people will have access to that toolkit. So I'll just stop there, and if there's any additional clarifying questions, happy to respond. Over.
Thank you so much, Matthew. We've actually come to the end of our time together. I think we're a minute over. I'd like to thank all of our panelists, Paul, Lauren, Israel, Dan, Matthew, for joining us. Bonnie also sends his thanks and regards for joining us. For all of you who have asked questions that we weren't able to answer, we will be able to follow up with you via email. And then Matthew referred to a link for information that PEPFAR has put out. I've just put that into the discuss option. It's an RFI link from USAID, which if you'd like to hear more about or get more information on, please feel free to reach out to us. And finally, anything on ARC you can find on our website or on social media. Thank you once again to everybody. Thank you to Jenny and the SAPEX team for allowing us to run this panel, and hope that you have a great rest of your day.
Thank you.
Thank you.
Yes, thank you all.
Thanks for having me.
you.
Thank you very much.
Thank you very much. Bye-bye.